Welcome to the channel. I am a doctor, and today I'll talk about never ignore this at night. 7 silent stroke. Warning signs, seniors. Miss the concept of a silent stroke is one of the most misunderstood and overlooked phenomena in geriatric medicine in 2026. Unlike the catastrophic events that involve a sudden loss of motor function or the inability to speak, silent strokes or silent cerebral infarctions operate with a level of stealth that makes them particularly dangerous for the senior population. By the time a senior realizes something is wrong, they may have already suffered dozens of these micro-events, which collectively lead to vascular dementia and significant cognitive decline. To understand the gravity of these signs, we must first look at the neurovascular landscape of the aging brain. As we age, the small vessels that penetrate deep into the brain tissue become increasingly susceptible to narrowing and occlusion. When one of these tiny vessels is blocked, a small area of brain tissue dies. Because this area is often not responsible for major motor control or speech, the individual does not feel a stroke in the traditional sense. However, the cumulative damage is profound. To reach the full investigative depth required to protect the senior population, we must deconstruct the 7 silent signs that are frequently dismissed as mere aging or tiredness. The first silent sign that seniors and their caregivers often ignore at night is the phenomenon of nocturnal spatial disorientation. This is not the simple confusion of waking up in a dark room. It is a sudden, transient inability to map the environment. A senior may wake up to use the restroom and find that for 30 to 60 seconds, they cannot remember where the door is or which side of the bed they are on. In 2026, neurologists have identified this as a hallmark of a lacunar stroke affecting the parietal lobe. The brain's internal GPS system is momentarily offline because the blood flow to the spatial processing centers has been compromised. Most families dismiss this as sundowning or a side effect of sleep medication. But when it happens suddenly at night, it is a signal that the brain's vascular integrity is failing. This disorientation is a mechanical failure of the neural pathways, and ignoring it allows the underlying cause, often undiagnosed hypertension or atrial fibrillation, to continue its silent assault on the brain. The second warning sign is the sudden onset of nighttime tinnitus combined with a fullness in the ear. While many seniors live with chronic ringing in the ears, a silent stroke can manifest as a new, high-pitched or pulsating sound that occurs specifically when lying down. This is often the result of microvascular changes in the internal auditory artery. When blood flow is restricted, the hair cells in the cochlea send distress signals to the brain, which are interpreted as sound. Because this happens at night when the environment is quiet, the senior may notice it more clearly, yet they often attribute it to allergies or earwax. In the 2026 clinical framework, we recognize that any sudden change in auditory perception in a senior is a vascular event until proven otherwise. This auditory shadow of a stroke is a silent cry for help from the brain's stem and temporal regions. The third sign is perhaps the most frequently missed, the nocturnal heavy limb sensation. This is different from a limb falling asleep due to poor positioning. In a silent stroke, a senior may wake up and feel that one arm or one leg is disproportionately heavy or difficult to move for a few minutes. They may find that they have to drag the limb across the sheets to reposition themselves. This is a subtle motor deficit caused by a blockage in the small vessels supplying the internal capsule or the basal ganglia. Because the sensation often resolves after a few minutes of movement, the senior assumes it was just a strange sleeping position. However, a dead limb that isn't accompanied by the typical pins and needles of a compressed nerve is almost always a vascular warning. It suggests that the motor pathways are being intermittently starved of oxygen. The fourth sign involves a sudden, inexplicable change in nighttime vision, specifically a temporary shutter effect. A senior may wake up and find that for a few seconds, the vision in one eye is blurry or dark, as if a curtain is being drawn across it. This is technically known as amaurosis fugax, and in 2026 it is considered one of the most reliable predictors of an impending major stroke. It is caused by a microembolism, a tiny piece of plaque that has broken off from the carotid artery and temporarily lodged in the retinal artery. Because it happens at night, the The senior may think they simply have sleep in their eyes or that they were dreaming. But this transient vision loss is a physical manifestation of a warning stroke. It is a sign that the plumbing of the neck is unstable and sending debris directly into the brain's visual processing units. The fifth warning sign is the nocturnal emotional lability or sudden uncharacteristic irritability upon waking. If a senior, who is usually mild-mannered, wakes up in the middle of the night feeling an intense sense of dread, anger, or confusion that is not tied to a specific dream, it may be a sign of a silent stroke in the frontal lobe. The frontal lobe is the brain's executive center and is responsible for regulating mood and personality. Small strokes in this area do not cause paralysis, but they do cause personality leaks. This is often the first sign of vascular depression or vascular dementia. Caregivers often miss this, chalking it up to a bad mood or poor sleep. But a sudden shift in the emotional baseline at night is a high-level neurological red flag. The sixth sign is the nocturnal swallow glitch. A senior may wake up and feel a sudden need to clear their throat or find that they are coughing on their own saliva. While this is often attributed to acid reflux or postnasal drip, in 2026, we understand that microstrokes in the medulla, the part of the brain that controls automatic functions, can disrupt the delicate coordination of the swallowing muscles. This is a silent form of dysphagia. If a senior is suddenly waking up choking or feeling a lump in their throat that wasn't there during the day, it indicates that the cranial nerves are being affected by silent vascular events. This sign is particularly dangerous because it can lead to aspiration pneumonia, which is a leading cause of hospitalization in seniors who have suffered silent strokes. The seventh and final silent sign is the fine motor stumble during nighttime tasks. This is best seen when a senior tries to do something simple, like turn on a bedside lamp, button a pajama top, or pick up a glass of water. If they find their fingers are clumsy, or they miss the target repeatedly, this is a sign of cerebellar or parietal microvascular damage. The brain's ability to coordinate fine movements is highly sensitive to oxygen levels. At night, when blood pressure naturally dips, these compromised areas are the first to falter. A senior might say, "I'm just tired," but tiredness does not cause a loss of basic motor coordination. This nocturnal clumsiness is the brain's way of showing that its circuitry is fraying. To reach the full investigative depth required to prevent the transition from silent strokes to a major event, we must examine the why behind the nighttime frequency. In 2026, the study of circadian hemodynamics has revealed that the morning surge actually begins in the middle of the night. Between 2 a.m. and 5 a.m., the body's sympathetic nervous system begins to ramp up, increasing heart rate and blood pressure to prepare for wakefulness. In a senior with narrowed or stiffened arteries, this surge can be enough to cause a microclot or a small bleed. Furthermore, many seniors suffer from undiagnosed sleep apnea. When the senior stops breathing at night, their oxygen levels plummet and their blood pressure spikes to wake them up. This cycle of hypoxia and hypertension is a stroke machine. Every time the oxygen drops, the brain is at risk. This is why these 7 signs almost always happen during the dark hours. The tragedy of the silent stroke is that it is additive. A single microstroke might only destroy a few thousand neurons, but over 5 years, a senior may lose a significant portion of their brain's white matter. In 2026, we call this leukoariosis, and it is visible on an MRI as small white spots. These spots are the graveyards of silent strokes. When a senior misses these 7 signs, they are essentially allowing their brain to be dismantled piece by piece. The investigative goal of 2026 medicine is to move from treatment to interception. If a caregiver or a senior can identify even one of these nocturnal signs, they can seek a vascular workup that includes a carotid ultrasound and an EKG to look for atrial fibrillation. Atrial fibrillation, an irregular heart rhythm, is the primary driver of silent strokes in seniors, as it allows blood to pool in the heart and form tiny clots that travel straight to the brain. We must also deconstruct the myth that aging is a decline. While the brain does change, it should not lose its mapping, its motor control, or its emotional stability overnight. The 7 silent signs are not normal parts of getting older. They are pathological events. In 2026, we emphasize the brain-first approach to geriatric health. This means that any sudden change in function, no matter how small, is treated as a brain event. The investigative framework also looks at the nocturnal blood pressure paradox. Many seniors are on blood pressure medication that they take in the morning. By the time 3 a.m. rolls around, the medication has worn off, leaving the brain vulnerable to that early morning pressure surge. Neurologists are now recommending nighttime dosing for certain seniors to ensure that the vascular shield is active when the brain needs it most. Furthermore, we must address the role of hydration in silent stroke prevention. Most seniors intentionally limit their fluid intake in the evening to avoid waking up to use the bathroom. This leads to a state of nocturnal dehydration, which makes the blood thicker and more prone to clotting. Thick blood moving through narrow, aging arteries is the perfect storm for a silent stroke. In 2026, the cellular saturation protocol encourages seniors to use mineral-rich hydration earlier in the day and to take a small sip and swirl of water before bed to keep the mucous membranes hydrated and the blood volume stable. This approach respects the senior's need for sleep while protecting their brain from the sludge of dehydration. The psychological impact of ignoring these signs is also profound. When a senior notices a heavy limb or a vision shudder and doesn't tell anyone because they fear losing their independence or being put in a home, they are inadvertently accelerating that very outcome. A major stroke is far more likely to end independence than the early treatment of a silent one. In 2026, we promote neurotransparency, encouraging seniors to report these glitches without fear. These glitches are not a sign of losing one's mind. They are a sign of a plumbing issue that can often be fixed with blood thinners, lifestyle changes, or simple surgical procedures to clear the carotid arteries. To conclude this investigation, the truth about silent strokes is that they are only silent if we aren't listening. The brain has a limited way of communicating its distress, and it uses these subtle changes in sight, sound, movement, and mood to signal that the vascular system is under siege. For the senior population in 2026, the nighttime is the most critical period for vigilance. By refusing to ignore the spatial disorientation, the ear fullness, the heavy limb, the vision shudder, the emotional shift, the swallow glitch, and the fine motor stumble, we can stop the silent progression of brain damage. Every night is an opportunity to protect the brain's white matter and preserve the senior's cognitive legacy. The future of geriatric health is found in the quiet moments of the night, in the recognition of the small signals that say something is wrong. We must empower seniors and their families to see these 7 signs not as inconveniences, but as life-saving data points. Your brain is an adaptable, intelligent organ, but it requires a constant, clean supply of blood to function. When that supply is interrupted, the brain speaks in whispers. It is time for us to start listening to those whispers before they become a scream. The 2026 path to longevity is paved with vascular awareness. Never ignore the night, for in its silence, the brain is telling its most important story. Building on this, the role of the microemboli must be thoroughly understood. These are microscopic fragments of cholesterol, calcium, or blood clots that are too small to cause a major blockage but large enough to cause localized cell death. When a senior experiences the vision shudder, it is often because one of these microemboli has temporarily lodged in the ophthalmic artery. While the vision returns, the event has left a scar on the vascular wall, making it stickier and more likely to catch the next piece of debris. This is the snowball effect of silent strokes. One event leads to inflammation, which leads to more events. In 2026, we use high-resolution imaging to see these scars, often finding that a senior who seems perfectly healthy has a brain that looks like a map of 1,000 tiny battles. This is why the 7 signs are so critical. They are the external manifestation of an internal war. Another investigative breakthrough in 2026 involves the glymphatic system, the brain's waste clearance pathway that only activates during deep sleep. For the glymphatic system to work, the brain's blood vessels must be able to pulsate effectively to pump the cerebrospinal fluid through the brain tissue. If a senior has stiff, atherosclerotic arteries, this pump fails. This leads to a buildup of metabolic waste, including beta amyloid and tau proteins, which are associated with Alzheimer's. A silent stroke further disrupts this cleaning cycle. When a senior wakes up disoriented or irritable, it may be because their brain trash hasn't been cleared out due to poor vascular pulsation. This creates a vicious cycle where vascular damage leads to protein buildup, and protein buildup leads to further neural decline. The 7 signs are often the first evidence that this cleaning system has broken down. We must also consider the vascular depression link. Many seniors are treated for clinical depression with traditional antidepressants, only to find they don't work. In 2026, we understand that late-life depression is often actually vascular depression caused by silent strokes in the white matter pathways that connect the emotional centers of the brain. When a senior wakes up with that sudden sense of dread or irritability, they aren't just having a bad day. They are experiencing a mechanical failure of their mood regulation circuitry. By addressing the stroke risk factors, cholesterol, blood pressure, and blood sugar, we can often cure the depression far more effectively than with pills. This is the power of recognizing the silent signs. It changes the entire treatment paradigm from psychiatric to vascular. The swallow glitch and throat-clearing signs also warrant a deeper look into the cranial nerve pathways. The nerves that control swallowing, the glossopharyngeal and vagus nerves, originate in the brainstem, an area that is highly susceptible to small, punched-out strokes. Because the brainstem is so densely packed with vital centers, even a tiny stroke can have outsized effects. If these nerves are weakened, the senior is at risk for silent aspiration, where food or liquid enters the lungs without causing a strong cough reflex. This is why the swallow glitch at night is so significant. It's a sign that the brainstem's vascular supply is compromised. In the 2026 clinical setting, this sign often triggers a swallow study and a specialized MRI of the posterior fossa to ensure the brainstem is intact. Finally, the fine motor stumble is a direct window into the health of the white matter tracts. These are the long-distance cables that carry signals from the motor cortex to the hands and feet. These cables are insulated by a fatty substance called myelin, which is extremely sensitive to changes in blood flow. When silent strokes occur, the myelin begins to fray, leading to a slowing of the neural signal. This is why the senior's hand feels clumsy or slow when reaching for a lamp. It's not a muscle problem. It's a cable problem. By the time this clumsiness is permanent, the damage is extensive. However, if caught during the nighttime stumble phase, we can often stabilize the myelin and prevent further fraying through aggressive vascular management. The 2026 message to seniors is one of vigilant optimism. We have the tools to stop these silent strokes, but we need the data from the patient. The nighttime 7 are the most important data points a senior can provide. They are the early warning system of the brain. By refusing to dismiss these signs as normal aging, seniors can take control of their neurological destiny. The brain is the most precious organ we possess. It holds our memories, our personality, and our connection to the world. Protecting it from the silent thief of microvascular disease is the ultimate goal of longevity science. Every nocturnal disorientation, every vision shudder, and every heavy limb is a chance to act. Do not let the silence of the night lead to the silence of the mind. Listen to the whispers of your brain and give it the care, the oxygen, and the blood flow it deserves to thrive well into the 2nd century of life. This investigative script is a call to action for every senior and every caregiver. Watch the night, heed the signs, and save the brain.